Hello, everyone. My name is Rivero. I am a medical oncologist. I'm also an endocrinologist at the National Cancer Institute, National Institute of Health. We're going to discuss one of the studies where I am proud to serve as a principal investigator here at the National Cancer Institute, and that's a tissue procurement and natural history study of neuroendocrine neoplasm. Just a little bit of a background, and maybe some of you are familiar with this graph. The incidence of neuroendocrine tumors has increased exponentially over the last few decades. As we can see here on the orange line, we can see that this is the incidence of neuroendocrine tumors, and the blue one is the incidence of other malignant neoplasm like colon cancer, breast cancer, prostate cancer. And as you can see here, when we look at this orange line, we can see that the incidence of neuroendocrine tumors has increased, but also the incidence has increased by site. We have seen an increase in the incidence of lung neuroendocrine tumors, as well as rectal neuroendocrine tumors, small intestine neuroendocrine tumors, and also pancreas neuroendocrine tumors as well. And you may ask, like, why we're seeing an increase of these neuroendocrine tumors. We think number one is because we are doing more diagnostic testing, such as colonoscopy, endoscopy, but also we have better imaging testing as the 68 gallium or 64 copper dot scans. And we're going to talk a little bit more about that. Also, the treatment of landscape of neuroendocrine tumors has also changed over the last decade. As we can see here, it was in the 1990s that we didn't have that many options, but it was in the last decade that we have seen in numbers of treatments for neuroendocrine tumors as well. But that said, what are the challenges in the management of neuroendocrine tumors? Even though we have a few FDA-approved agents or therapies, like I just discussed, when and what combination therapy approach should be used is still a question. Also, what is the sequencing of treatment? And that's also a question that we have among all of our patients with a diagnosis of neuroendocrine tumors. Another question and challenge is that how long should treatment be continued? Also, what subgroup of patients a particular treatment option should be used on? And now, what is the role of immunotherapy as well in neuroendocrine carcinoma? And I also invite you to see other LACNETS videos and webinars where they describe about what is the use of immunotherapy for neuroendocrine tumors as well. But based on the challenges that we have faced in the management of neuroendocrine tumors, I believe, and based on the natural history that we have here at the clinical center, is a comprehensive classification system that incorporates tumor clinical stage, genomic, and epigenetic alterations, as well as gene expression profiling, can serve to better define the biology of neuroendocrine tumors. And that's something that we're doing as part of the study. Besides all the clinical findings and manifestation of neuroendocrine tumors, we also wanted to understand what is the genomics or the gene expressions that we see in the cells with neuroendocrine tumors. And we are hoping with this, we can establish correlations with clinical outcomes, as well as develop effective therapies for neuroendocrine tumors. Now, in terms of what are the challenges that patients with neuroendocrine tumors, as well as their families face, is that it can take a long time to diagnosis, and often the cancer is identified at advanced stages. Also, most medical centers has limited experience with these tumors, and patients often has to search for experts and potentially requiring extensive travel outside the home region. We don't have standardized treatment guidance, and that sometimes creates uncertainty in a search for answers. And often, because of these, patients can feel isolated. But we're hoping with the studies that we're doing here, the clinical center, the NCI, and as part of the natural history studies, that developing an easily accessible national engagement network for NET research, as well as collaborative patient advocacy and support groups, will address some of the needs above. And I do strongly recommend that LACNETS is one of the support groups and advocacy groups that have a lot of information. And I also encourage you to also listen a lot of the webinars that LACNETS is providing. But we feel that by having this collaboration with advocacy support groups will address some of the needs that I already mentioned, as well as increase the access for patients to research. But also the NET researchers also face hurdles to develop cures. Sometimes because neuroendocrine tumors is considered to be a rare cancer, sometimes it can take a long time to accrue patients into clinical trials. Sometimes we need a multidisciplinary care for patients living with neuroendocrine tumors, as well as with those neuroendocrine tumors associated with cancer predisposition syndrome. Sometimes there is a lack of coordination between teams, and that creates silos that limit efficiency, as well the incorporation to clinical trials. One hurdle that we as an investigator or a NET researcher we always face is that we have limited diversity of neuroendocrine tumor cell lines, and they're also not validated patient-derived xenograft. And because of that, we often encounter these limitations in order to develop therapies for neuroendocrine tumors. Moreover, fundraising for research is challenging because there is less resources or grant funding, and those are some of the hurdles that neuroendocrine tumor researchers often encounter. One of the possible solutions is a collaborative, well-funded research network for neuroendocrine tumors will promote development of new therapies and standards for patient care. With all of this information, that's the reason why it motivated me to develop a natural history study to then form collaborative efforts with different groups and also be able to understand more about the biology of these tumors. But before we discuss about the natural history study, I just wanted to also describe what are clinical trials. And again, this is just a small overview that led me to develop this natural history for neuroendocrine tumors, but I also encourage you to listen other informations about clinical trials with the LACNETS. But clinical trials are research studies that test how well new medical approaches work in people. And through clinical trials, doctors find new ways to improve treatments and the quality of life for people with certain diseases. And researchers design clinical trials to test new ways to treat cancer, find and diagnose cancer, prevent cancer, and also manage symptoms of cancer and side effects from this treatment. Clinical trials are also the final step in a long process that begins with research in the lab. And before any treatment is used in people in clinical trials, researchers work to understand its effect on cancer cells in lab and in animals. They also try to figure out the side effects it may cause. But in terms of clinical trials, also natural history studies are part of these clinical trials because it allows us to follow people with cancer over long periods of time. And as part of this study, researchers can collect details about the patient's medical history, tissues, such as blood and saliva, and tumor samples, and also other data as well. So in order to conduct this natural history study, we ask multiple questions about the biology of these tumors, but also this information will help us to understand more about the specific cancer, how do specific cancers form, growth and spread, what genes cause the cancer to develop at a high rate in certain families, what we can learn, or we can learn other clues to help prevent cancer, and as well as can we learn clues to help develop new treatments. And that's the reason why these natural history studies are developed. And with all that information, like I said earlier, I was fortunate to be the principal investigator of this tissue procurement and natural history study of neuroendocrine neoplasm, with the primary objective to characterize the natural history of neuroendocrine neoplasm. The data that we included as part of the study is to include patient demographics, clinical characteristics, patterns of disease progression, response or lack of response to therapeutic interventions, disease recurrence, and as well how long the patients lived with the neuroendocrine tumors as well. So how patients comes to the clinical center, either the patient themselves or the referring physicians contact us, and then we collect all the clinical information, pathology, as well as imaging reports. With all that information, we have all the expertise here at the clinical center. We like to discuss with different specialty in a way of multidisciplinary review of tumor boards, and then we provide our opinion to the patient as well as the physician. We also provide the patients to enroll into the data collection, clinical care, and interventions within the clinical center. This protocol allows us to bring patients to the clinical center and also provide care and surgical interventions as well. These patients can also enroll in different studies. And one of the studies is to also be part of the natural history study. And that allows me to follow patients over long periods of time. But also we have clinical trials for neuroendocrine tumors, but also we can enroll patients into other treatment studies within the clinical center. And one of the studies that we have for neuroendocrine tumors is a study of 177 lutetium dotatate in combination with olaparib for patients with gastric and pancreas neuroendocrine tumors. And please, I want you to listen to the video that explained this study. In terms of how, as part of the natural history study, how we understand more about the biology of these tumors, whenever a patient comes to the clinical center and they may be eligible for surgery, we work together with one of the surgeons here at the clinical center, Dr. Jonathan Hernandez. And then once we do surgery, we collect a small piece of the tumor that we can study in different ways. One of them is to also obtain a detailed information about the genomics of the tumors. And we wanted to correlate those genomics with treatment response as well to then help us understand what patients may respond to different treatments. And that's one of the questions that we have. We also want to develop models. As I say earlier, one of the challenges as for neuroendocrine tumor expert researchers is that we don't have enough models. So we're trying to develop models as well to then test different drugs. And then with that information, be able to develop therapies for neuroendocrine tumors. We also wanted to understand more about the tumor immune microenvironment of these tumors and be able to understand how the immune system can work in order to treat the cancers related to neuroendocrine tumors, as well as develop more preclinical models that would allow us to test different therapies. With that information, and if you want to be a part of the natural history study, you can contact us directly. There is also a CCR, which is the Center for Cancer Research Referral Coordinator, and the number is provided here. But had to be part of the study. Once you have the diagnosis confirmed by your own doctor of neuroendocrine tumors, you can contact us directly. Also, if you have patients that are seen at the clinical center that are also seen under a protocol that help us understand about that specific disease or tumor or illness. And that's why we have this natural history study for neuroendocrine tumors. In the research team for the treatment trial, we can also review the records, and depending on the records, then we invite you to the clinical center for a screening visit as well to be part of the different studies that we have here at the NIH for neuroendocrine tumors. Once you enroll in a clinical trial, care at the clinical center is free. And if you need more information, there is a website listed here for more information about the clinical trials. And with that, I also wanted to mention that there is different ways that we can help you to provide information as well. And in terms of clinical trials or treatment trials, there is a lot of information here and a number that you can refer to as well. And of course, you have my email, and I want you to please feel free to reach out anytime for any questions. And if you want to be part of the study. And with that, I'd just like to finish that individually we're one drop, together we're an ocean. But I also wanted to thank our real heroes here, which is our patients and caregivers. And you have my information here, my email and my phone number. And please don't hesitate to reach out anytime. Thank you.